Good evening, good afternoon, and good morning. This is the 1728th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. VIJENDRA Kumar Pratap Singh. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30, and from 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, the local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends so that the purpose of the forum is to take homeopathy to every home around the world. And let me introduce the guest of the day. It is none other than Dr. Vijendra Kumar Pratap Singh. Sir has completed BHMS and is the director and MD Homeo Lab Private Limited, Gazaipur. And he is the most popular practitioner of Gazaipur, Uttar Pradesh. And he has very recently presented some physical seminars internationally, and it has just joined from outside India. So we are proud to have such a personality here to deliver today's session. And very, very interesting subject is being presented here, consideration of causes as the prime factor for the evaluation in acute diseases. So has presented so many sessions in both Hindi as well as English in this forum. So we proudly welcome you to this session. Welcome, sir.
Okay. Thank you. Thank you very much, sir. You have to make me the host because it is not showing on my screen, sir.
You are the host. You are the co-host. No problem. You can start.
Yes, sir. You may restart once again. Share. Firstly, you started sharing, but unfortunately you missed it, and you can share it now once again.
Okay. I'm going to share.
Please stop sharing and then restart sharing.
Stop sharing and then restart sharing.
Yes.
How can I? Because
just there is at the center you can see a green where there is share. You just click on that. So, okay, it's coming. It's coming. Okay, everything fine now. Yes, you can see all this thing.
Am I audible, sir?
Yes, everything fine. You can go ahead.
Good evening, ladies and gentlemen. And first, I would like to thank Dr. M.K. Sahni, sir, and Dr. Dhanesh, sir, and all the people who are right now in this meeting. I think this is not first time because in the past, I have got opportunity to share my experience, share my knowledge in this platform. And let me tell you one thing, that this platform is one of the biggest platform for homeopathy as far as knowledge is concerned, because doctors from various part of the world have got opportunity to share their experience, share their knowledge. And I think this platform is the best platform. And for that, I would like to congratulate and I would like to thank Dr. M.K. Sahni, sir, and all his team member. My dear friends, the universe is composed of billions and billions of galaxies. And every galaxy is having billions and billions of stars. And almost every star is having their own solar system. And one of the solar system is our solar system. In our solar system, there are so many planets. One of the planet is Earth, where we live. Earth is a single known planet where there is life. My dear friends, why I'm talking about this? What is the reason of talking about this planet and universe in this homeopathic platform? Think about yourself, that how small we are, and think about the size of the universe, how big, how enormous, how gigantic, how endless, how limitless universe is. But why I'm talking about? Because there is a close resemblance of universe with homeopathy. And there are 2 points. The first point is, as far as homeopathy is concerned, homeopathy is also big, enormous, endless, limitless. And the second point, instead of a big size, instead of a gigantic size, limitless size, endless size, a very less amount of information is available for universe. Similarly, when we talk about scope of homeopathy, the maximum part of the scope of homeopathy is still concealed. And if we want to reveal the concealed portion of the scope of homeopathy, we have to become the truth teller. We have to share our experience, exactly what we are experiencing in the clinic. We have to free from hyperbolism. We don't have to become hyperbolic to make our presentation wonderful or catching attention of all the people. We don't need to do that, because truth is a stranger fiction. So what we have to do, we have to just, tell the truth. But how we can give the incredible result? How we can make this homeopathy on top? My dear friends, today I'm going to show you some of the cases of Bell's palsy. But before showing the videos of Bell's palsy, before and after videos of Bell's palsy, I would like to give you some of the examples so that you will become more aware with my topic, more aware the things which I'm going to tell you. So what are the things which are responsible for giving the incredible result, which are responsible for the selection of the most accurate medicine, which are responsible for do the correct evaluation of symptom? Consideration of cause as a prime factor for evaluation in acute diseases. This is the most important point. What I mean to say, for making you understand about this, whatever I have written in front of you, I would like to give you some of the examples. And those examples which I'm going to show you are practical examples, not in one, not in two. In multiple number of cases, I have seen the incredible result by following this. What I'm following? Consideration of cause as a prime factor for evaluation in acute diseases. So let's have a look. Abdominal pain. If you can see in the picture, there is a pain in the abdomen. What is the posture? The posture is a stoop posture. The posture is forward flexing posture. So as soon as the picture is in front of you, you will be thinking about so many medicines. Yes, you will be thinking about colosynthesis, magnesia phos, pulsatilla, and ignatia. These are the common medicine whenever a patient comes to you having pain, exquisite pain in the abdomen, great pain in the abdomen, the patient is tossing in agony. And the posture is a stoop posture. Patient is not able to sit straight. Patient is not able to stand straight. He is in a flex posture. The traditional double bending posture are rare, but patient will come to you and you can understand by seeing that patient is in a slightly fixed posture when come to your clinic. So whenever you have a case, you will have so many medicines like colosynth, like magnesia phos, pulsatilla, and ignatia. My dear friends, instead of the characteristic presentation given by the patient, instead of the most characteristic indication which you can see in the patient, if you select the medicine on the basis only of these symptoms, I think that would be the wrong prescription. What I'm trying to tell, if there is abdominal complaint, I'm talking about the acute problem, my dear friends. If there is abdominal complaint, if there is abdominal pain, which has just happened, few hours back, if there is exquisite abdominal pain, if there is nausea, if there is vomiting, so you have to ask one thing from the patient, that is, what was the last meal? That is the most important thing which you have to ask. What was the last meal? What you have taken just before the origination of these symptoms? If the answer is fish, if the answer is fish, then what would be the medicine of choice? The medicine would be Chininum ars. I have also, shown you the potency, because it is important to make you know about the potency as well. Because without potency, a medicine is just like a bride without ornaments. So we have to tell about the potency, and we also have to tell about the reputation of a medicine. My dear friends, Chininum ars would be the medicine of choice. Instead of the characteristic indication given by the patient was having relief in double bending posture. So I was not thinking about, Colocynth, I was not thinking about any other medicines which are having these characteristic symptoms. What I was thinking, I was thinking that I have to ask one thing, that what was the last meal? The patient have told me that he has taken fish. My dear friends, if the answer is fish, in abdominal discomfort, in any other abdominal complaint, just forget about the intensity of the pain. It may be high, it may be very high, it may be mild. But if the answer is fish, the medicine would be Chininum ars. My dear friends, this medicine is going to stop the progression of the disease. This medicine is going to abate the symptoms. This medicine is not only applicable if a patient come to you having fish allergy. This medicine is also applicable even before the intake of fish in a patient who is having fish allergy. What I mean to say, this medicine is also applicable as a preventive medicine. Suppose if you are having fish allergy, if you take this medicine half an hour before the intake of fish, if you are having fish allergy, I'm talking about. If you are having fish allergy and if you take this medicine before the intake of fish, this medicine is going to stop the development of all those unavoidable symptoms which were previously present when you have taken, fish before. So this is also applicable as a preventive one. My dear friends, in the first examples which I've given to you, these are purely practical examples, and I have seen in multiple number of cases. So if you prescribe the medicine on the basis of the cause of the disease in acute one, I think that would be going to be the most correct prescription of yours. Have a look on the second one. Again, abdominal pain. And look at the posture. It is a bending backward posture. As soon as the patient comes to you, instead of having a great pain in the abdomen, the patient is coming to you by walking straight and slightly backward posture. It may happen in some cases, but most of the cases you can see that patient will come to you in a straight posture. The patient is sitting on the table in a straight fashion. So when you ask a simple question, what happens when you stoop, when you flex, patient will tell you that, doctor, I'm having pain as soon as I'm stooping, as soon as I'm having a flex posture, and that's why I'm sitting straight. So as soon as these symptoms come to you, you will have some of the medicine, and I know what you are thinking right now. You're thinking about Diascoria and Brownia alba. My dear friends, in my clinical practice, I'm practicing since last 13 years, and Brownia and Diascoria complement each other. When you have a case and you don't have a particular cause, a case come to you having abdominal pain, I'm only talking about the abdomen. I'm not talking about other part of the body. I'm talking about the abdomen. If a patient come to you having abdominal discomfort, abdominal pain, and there is no definite cause, and if the posture is backward bending posture, if the patient is sitting in front of you in a straight fashion, and if patient is telling that he cannot stoop, he or she cannot stoop, he or she cannot, apply a flex posture, Brownia and Diascoria, these two medicine in a 30 potency complement each other. So my dear friends, the medicine is Diascoria and Brownia, but only on the basis of the symptoms given by the patient without asking the cause. I think that would be the wrong prescription. You have to ask one question, that what was the last meal? If the last meal was egg, What would be the medicine? The medicine would be Morgan P in a 200 potency. My dear friends, again, I have selected the medicine on the basis of the cause of the suffering of the patient. Morgan P is going to give its result within 1 to 2 minutes. Exquisite pain in the abdomen, even headache after taking egg. Whatever is happening after taking egg, you don't have to worry about. But after taking Morgan P, the symptom is going to abate within a minute, 1 to 2 minutes. My dear friend, this is the speed of Morgan P. This is the speed of homeopathic system of medicine. If we talk about the fastest car in the world, I think it is Lamborghini, it is Ferrari, it is Bugatti. These are the three cars which are the fastest one. When we talk about the fastest acting pathy, I think homeopathy stand the first. Homeopathic medicines are having the fastest action, and that is the velocity, that is the speed of action of homeopathic medicine. So if you have a case where patient is having exquisite pain in the abdomen, where the patient is having great amount of headache, my dear friends, the medicine would be Morgan P. And again, Morgan P is not only applicable after the development of symptoms in a patient having egg allergy. It can be also given before the intake of egg in a patient who is having egg allergy. This medicine, if you are going to take egg and if you are having egg allergy, just take this medicine just before the intake of egg. I mean, 15 to 30 minutes before. This medicine is going to stop the development of the symptoms which were previously present when you have taken egg in the past. My dear friends, Morgan P is a wonderful medicine. So in these two cases, what I have told you about that consideration of cause as a prime factor for evaluation in acute cases. What is evaluation? Evaluation is grading of symptom according to their value in order to form the individualistic picture of the disease by taking the totality for the purpose of selection of the most accurate medicine. And here, for evaluation, I have given more importance to the cause, because cause are the real culprit, cause are the real offender. So try to find out the cause and select the medicine on the basis of the cause of the disease if you have acute case. Moving to the next example, have a look at this. What is this? This is Titanic. 1914 was the year when the biggest ship of that time, Titanic, sank in the sea. But who was the culprit? What was the reason behind that? Who was the offender? The offender was a small piece of ice mountain. Interesting and surprising as well. How could an ice mountain, how could an iceberg became the reason for making the bottom of the sea the graveyard of the biggest ship of that time, Titanic? The reason was the structure, the anatomical structure of, the iceberg. What is the anatomical structure? You can see in the screen, a very small portion which you can see outside. And if you can see the structure just below the water, the concealed structure which we can see from outside, it is 9 to 10 times bigger than the structure which is revealed outside, my dear friends. But how can we relate this iceberg with homeopathy? If you, watch the external, external structure, the structure which is, I'm sorry, the structure which is outside of the water. And if you compare this structure with the symptoms of Materia Medica, a single line symptoms of Materia Medica, my dear friends, this structure is telling us that we have to dissect a simple symptom. As you can see, a very small portion is outside, but if you see the whole structure of the iceberg, it is 9 to 10 times bigger inside. So a single symptom which is written in the Materia Medica, if you understand that symptoms properly, if you do correct interpretation of that symptoms, if you try to relate a single symptoms with practice of medicine, with pathology, with anatomy, my dear friends, you can create new symptoms, just like an iceberg. You can, create a new clinical Materia Medica. You can explore a single symptoms. You can create new area of working of that medicine, my dear friends. And that's what I'm trying to tell you, that we have to do the correct interpretation. In the first example, we have seen that consideration of cause as a prime factor for evaluation in acute diseases. And the second one is what? Second one is try to do the correct interpretation. And I'm going to tell you some of the examples. And yes, those examples which I'm going to show you are purely practical examples. And I've seen in multiple number, uncountable number of cases having great results. Let's have a look. Chest pain. When we talk about the chest pain, of course, is a medical emergency. If you have a case of chest pain, first you have to bifurcate that what is the cause of the chest pain, because it may be due to the heart complaint like myocardial infarction, like aortic dissection, like myocarditis, pericarditis, like cardiomyopathy. There are so many diseases of the heart which are there, comes in a row as far as the heart causes are concerned. There are some of the respiratory causes as well, like pneumothorax, like pulmonary thromboembolism, pulmonary infarction, and pleurisy. There are some neurological causes as well. And we also have, trauma in the history, chest trauma in the history. There are some neuromuscular disorder as well. And there are some gastric causes as well. Chest pain due to the gastric problem, like GERD, like gastric flatulence, my dear friends. So here I'm going to talk about chest pain due to the gastric flatulence. When you ask that what is the cause, if the cause is gastric flatulence, what would be the medicine of choice? My dear friends, we have so many medicines like Telia, spelling start from P, Telia, and we have Carboveg, we have Ignatia. All these medicines having action on the upper abdomen. But when we talk about the real medicines, which is the real hero, which is the real one, that medicine is Leptodactylus mactans. Yes. But as I've told you that we have to do the correct interpretation. Not a single materia medica is there where it is written that Leptodactylus is a good medicine for chest pain due to the gastric flatulence. It is written nowhere. Then why I have selected this medicine? I've told you in the beginning that we have to do the correct interpretation. So what is written in Leptodactylus mactans? If you go through the literature of Leptodactylus mactans in Murphy Materia Medica, what is written there? Or in Boric Materia Medica, what is written there? It is written that Leptodactylus mactans having prominent gastric problem. It is applicable for most of the gastric problem. And it is also written that Leptodactylus mactans having prominent chest problem. It is applicable in most of the heart complaint. So how I have interpreted? Because there are so many other medicines like Ignatia, like Carboveg, but why I have selected Leptodactylus for chest pain due to the gastric problem? Because the prominency of the abdominal complaint and the prominency of the heart complaint together, it is only written in Leptodactylus. It is not written in Ignatia. It is not written in Carboveg. Yes, heart complaint is also there in Carboveg, also there in Ignatia, but not as prominently as present in Leptodactylus. There is distension of the upper abdomen. There is irritation of the phrenic nerve. And that's why, there is upward pressure upon the diaphragm. And that's why there is stretching type of pain in the chest here and there. My dear friends, Leptodactylus would be the medicine of choice. Give this medicine in 200 potency, and I'm pretty much sure that you will have the same result what I have seen in my clinic. The second example, look at this, renal colic. One of the common problem in clinical practice, a patient come to you having pain in the renal region. Some patient will come to you where the pain is radiating from loin to groin, even going to the thighs. My dear friends, when we talk about the renal colic, I'm talking about renal colic, the renal pain. When you talk about this, there are so many medicines like belladonna, and you all know that belladonna is one of the best medicine for renal colic, uh, especially I use in 200 potency. It is applicable in both side renal colic. Pereira brava is usually applicable for left-sided renal colic, and one more symptoms which is written there, a very specific symptom, that is pain from loin to groin, even to the thigh. It is written in Pereira brava. Lycopodium is for right-sided, I mean renal colic. Berberis virgalis usually left-sided, but this is also applicable right one. Magnesia phos is also one of the great medicine for renal colic. Especially I use in 6x potency. Osimum can is also one of the great medicine for renal colic, especially the right renal colic. And it is also written there that impaction of the stone in the ureter, my dear friends. Lachesis is applicable for left-sided, but lachesis usually in the terminal stage, when you have not result by using so many medicines, you can give lachesis frequently, you will have the results. Chimaphila, whenever there is bleeding and there is pain, you can use Chimaphila in a 200 potency. Sarsaparilla is also one of the medicine, and it is applicable in a higher potency. I use Sarsaparilla 1M frequently. Whenever there is impaction of the stone, is usually right-sided, when the stone is impacted in the uretrovesical junction. Calcarea renalis is also one of the medicine which having great action on renal colic, my dear friends. And there are so many other medicines which I have not mentioned, like Phyllanthus neruri is also one of the medicine for that. But I am not here to talk about these medicine. I'm here to talk about the captain of the ship. I'm here to talk about the captain of the team of renal colic. I'm talking about the hero of the film, and the hero is Coccus cacti. Coccus cacti in a 200 potency, you can also use in 30, but I generally use 200 potency. But my duty is to make you know about the repetition. First, let me make you know about the repetition, and then I will tell you about the cause that why I have selected Coccus cacti instead of so many other heroes, so many other medicine, so many other giant for renal colic are present in Madurai Medical. But why I have used this medicine frequently? My dear friends, what is the repetition? Use this medicine 3 to 4 doses right in your clinic at the interval of 5 minutes. Give 1 dose Coccus cacti. After 5 minutes, give second dose. After 5 minutes, give third dose. After 5 minutes, give fourth dose of Coccus cacti. In more than 85% of cases, I am telling with lots of responsibility. In more than 85% of cases, patient will tell you within 20 minutes, doctor, I'm having relief, 30% relief, 40% relief, 50% relief. Some patient will even tell you, doctor, I'm having 70 to 80% relief within 20 minutes after using Coccus cacti in multiple doses, multiple repetition. But I want to ask a question, that why Coccus cacti? Why not something else? We have so many medicines in a row. We have so many giants in a row. Why Coccus cacti? The answer is somewhere written in the Clark Madurai Medical. So what is written there? Pain from loin to groin and down thigh. You can ask the doctor. This symptom is also written in Pereira brava. Then what is the difference? I would tell that just continue the symptoms. What is written in the next line in Clark Madurai Medical for Coccus cacti in renal colic? It is written that as if the fluid is forcing its way down, as if the fluid is forcing its way there. What it's mean? There is uncomfortable awareness of the movement of the fluid from kidney to the through ureter to the urinary bladder. Uncomfortable awareness. You can feel that the fluid is moving there. Why? Why these type of sensation are there? What a wonderful symptom written in Clark Materia Medica. Amazing. Because if there will be impaction of the stone in the lower part of the ureter, or anywhere in the ureter, or even in the kidney, if the stone is obstructive stone, there will be difficulty in the movement of the fluid, the forward movement of the fluid. So what will happen? There will be uncomfortable awareness. You will aware of that movement. You will aware of the movement of the fluid. You will aware of the movement of the urine from kidney through ureter into the urinary bladder. My dear friends, it is only written in Coccus cacti, and that's why Coccus cacti is a medicine of choice. And that's why I've selected the medicine Coccus cacti. What I'm trying to tell you, I'm just trying to tell you that select the medicine by doing the correct interpretation. The first two examples I've given about select the medicine on the basis of the cause. If you have the cause, go with the cause. But what is the cause behind selection of Coccus cacti? I have told you the cause. The symptoms which is written in the Clark Materia Medica. Go through the Clark Materia Medica. In Coccus cacti, you will have your answer. As if the fluid is forcing its way there. And that's why Coccus cacti, I have chosen Coccus cacti. Let's have other example. Gastric headache. Headache is one of the most common problem in clinical practice. You will have frequent encounters with these patients. I mean, gastric headache. If you have a gastric headache, or if a patient having gastric headache, there are so many medicines. A number of medicines you have, like iris versicolor, like ipecac, like taraxicum, like cheridonium, like lycopodium, like carboveg, like ignatia, like nux vomica. So many medicines, uncountable number of medicines are there. If a patient come to you and patient is telling that, doctor, I'm having heaviness in my head, and patient is telling you that, doctor, it seems as if the gastric flatulence is moving to my head. It is climbing to my head. This is the style of presentation of the symptom by the patient who is having gastric headache. Some of the patient will tell you about that. Doctor, as if the gas is moving towards my head. My dear friends, the medicine which I am going to, tell you, and I have used that medicine in more than 500 cases. In 13 years of my practice, more than 500 cases. In more than 90% of cases, you will have the results. The medicine is Homeopathy in a 30 potency. I'm not telling about the conventional gastric headache. I'm telling about the patient having, a patient will tell you that, doctor, I'm having, heaviness in my head, or I'm having, heaviness in my eye, I'm having heaviness in my occipital region, and sometimes a headache, as if the gas is climbing to my head. And if there is relief of these symptoms after eructation, after passing flatus, then Homeopathy would be the medicine of choice. But the question is, why Homeopathy? Why not something else? Why not Bismuth metallicum? Why not iris versicolor? And why not any other medicine? My dear friends, we can also go with those medicines, because you have also given those medicine in so many cases with good results. So what I want to tell you, that add this one as well in your arsenal. It is written that when head, throat, and abdomen symptoms comes together, if head, throat, and abdomen symptoms comes together, Homeopathy would be the medicine of choice. And according to my clinical practice experience, if you have head symptoms and abdomen symptoms together, you can also give Homeopathy. I think this medicine is going to satisfy you in more than 90% of cases. My dear friends, understand the symptoms what I'm telling. Patient having heaviness in the head, and patient is telling that, doctor, as if the gas is climbing to my head, and I'm having relief after eructation and passing flatus, then Homeopathy would be the medicine of choice. My dear friends, I have given you 5 examples before showing cases of Bell's palsy. Why I have shown you? I have shown you these cases just because to make you aware that selection of the medicine on the basis of the cause is why important. Why? And correct interpretation is important as well. 2 points. Find out the cause and correct interpretation of the symptoms. If you are doing these two together, I think you will have the correct medicine in a row. Now coming to the main case, and that is Bell's palsy. My dear friends, some diseases are big with their name, and some diseases are big with their suffering. Oh my God, what I'm trying to tell. Cancer, and some other immunological disorders are big. But some diseases are small, but the suffering which makes you anxious, which makes you restless, not only you become anxious and restless, your family member and the person who is living around you become also anxious. I'm talking about a disease which make your face diverted. Distort. Your mouth is deviated away. You are not able to close your eye. Wrinkling is absent on one side. Frowning is absent on one side. You are not able to do proper conversation. During conversation or during showing your teeth, the mouth is deviated away from the lesion. There is drooling of saliva. You cannot hold the water in your mouth. It is coming out from the affected side of the face. What will be the mental condition, my dear friends? I think this disease would be that time bigger than cancer because of the suffering, because of the intensity of the suffering. My dear friends, this is the first case. I think the video is not, I'm not able to play this video. I have to go out and then again. I'm going to show you some of the before and after video. I will show 5 cases of Bell's palsy and then I will talk about the medicine. Look at this.
हाँ, माथा सिकोड़िए, ठीक है, फिर सिकोड़िए,
Is not able to close her left eye.
ठीक है, आंख बंद करने की कोशिश कीजिए, ठीक है, ऐसे दांत दिखाइए, ऐसे.
The wrinkling is absent. The mouth is deviated towards the right side. It is a clear case of left-sided Bell's palsy.
कितना दिन हो गया?
And she was having recurrent attack.
नवंबर से है.
My dear friends. I want to show it again. Look at this. The mouth is deviating towards the right.
ठीक है, फिर सिकोड़िए.
The wrinkling is absent on the affected side. She cannot
आंख
close
बंद करने की
the
कोशिश
left eye.
कीजिए.
It is a clear case of left-sided Bell's
ऐसे दांत दिखाइए, ऐसे. हाँ, बाएं साइड का है इनको. कितना दिन हो गया?
नवंबर का है.
नवंबर से है.
जी.
I'm going to show you the next video of that lady. Look at this. This is the next one. Have a look on this. What a great improvement. Now you can see the mouth is very symmetrical. Look at this.
आंख बंद कीजिए.
She can close her eye by putting some of the effort. The mouth is deviating, but you can see it is telling that it's having great relief.
थोड़ा सा है, अभी और होना है. अभी ये जो माथा है लेफ्ट वाला, इसको सिकुड़ना चाहिए.
In the previous video, she couldn't close her eye.
है ना, और वो
मुंह भी खींच रहा था ज्यादा ना.
खींच रहा था. अब ठीक है, काफी ठीक है.
Have a look at the third video of that lady. The third one.
दांत दिखाइए.
What a great improvement. Now she can easily close her eyes. Look at this.
ऐसे ऐसे कीजिए.
She can blink her both eyes.
ऐसे.
Previously she couldn't blink her eyes so easily.
ठीक, मुंह खुलाइए.
That is the power, that is the strength, that is the efficiency of homeopathy. If I have got the result, you will have the same result, my dear friends. Have a look on the second case. Second case of Bell's palsy. Look at this. The mouth is deviating towards the left side. It is a clear case of right-sided Bell's palsy.
पूरा दिखा
Look at this. The mouth is
माथा सिकोड़िए
deviating towards the
माथा
left
सिकोड़
one.
ऐसे ऐसे हाँ 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 ये
The
आँख
wrinkling
बंद करो
is absent on the right side. Look at the right eye. She cannot close his right eye properly. Look at the power of the left
पूरा
eye.
दिखा
Look at this.
माथा
Power of
सिकोड़िए
the left eye and
माथा
see
सिकोड़
the power of
ऐसे
the
ऐसे हाँ
right.
हाँ हाँ ये आँख बंद करो
She can easily close his. He can easily close his left eye, but have a look the follow up. Look at the follow up. See.
आँख बंद करो बेटा
Eye closure is good.
दांत दिखाइए
The mouth opening is also symmetrical.
अच्छा माथा सिकोड़िए
Frowning is also wrinkling is also present.
पहले तो तुम्हारा इधर नहीं सिकुड़ रहा था ना हाँ और जरा मुंह फुलाओ
Now he can
हवा मत
hold
निकलने
the
देना
air in the mouth, but slight amount of air is evacuating from the affected
फुलाओ
side.
फुलाओ फुलाओ निकलने मत दो हाँ ठीक है अब तो
इधर से हल्का निकल रहा है
हल्का सा ना
He's telling
पहले
that
से
a
तो
slight amount of
काफी
air is, evacuating from the right side of the
हवा नहीं ऊपर
right side of the mouth.
अब ऐसे मतलब हवा
But he's almost cured
रख
within
पा रहे हो
7
हो
days.
रहा है मतलब
ठीक ठीक है बेटा
Have a look on the last follow up this patient. Look at this. It's completely okay now.
बाल हटाओ ऐसे माथा सिकोड़ माथा पूरा सिकोड़ हाँ और
The
ऐसे करो
wrinkling is present. The frowning is present on both
आँख
sides.
बंद करो
The eye closure is good.
दांत दिखाओ
The mouth opening is also
मुंह
symmetrical.
फुलाओ
Now he can hold
जीभ
his
निकालो
air in the mouth. Everything is symmetrical. Everything is
ठीक
perfect.
है अब तो
He's
कंप्लीट हो गया
completely
ना
cured in 15 days of the treatment. I will tell you about the medicine in the end. Let's have a look on the third case. Look at this. Third one is here. It is an amazing case of left-sided Bell's palsy. He cannot close his left eye, and you can see on showing history, the mouth is deviating towards the right side. It is a clear case of left-sided Bell's palsy. See the follow-up video. Look at this.
आँखें बंद कीजिए
Now he can close his both eye, but you
माथे
can
को
see
सिकोड़िए
a slight amount,
माथा सिकोड़िए
ऐसे
ऐसे ऐसे हाँ ऐसे कीजिए फिर हाँ
wrinkling is present, frowning is present.
दांत
He
दिखाइए
can open his mouth properly, and on showing his teeth, the mouth opening is also symmetrical. But the left eye closure is a little incomplete. He is telling that he is 50% relief. According to the patient, he is 50% relief. And within 7 days, within 6 to 7 days.
कैप्सिकम आपको दिया गया था ना ठीक कान में आपको दिक्कत हुई थी ना पहले कान में दर्द हुआ था उसके बाद ये चालू हुआ बस ठीक
Just see the third one. This one is the, where is the third one? Look at this. Absolutely fine. Wrinkling is present. He can close his both eye with so much ease. Look at this. And see the structure of the face. It is purely symmetrical. He can hold the air in the mouth. and the mouth opening is also symmetrical. He is completely fine with the help of homeopathic medicine. Now I'm going to show you the fourth case. See.
माथा सिकोड़िए माता जी। हाँ ठीक है। आ कीजिए आ दांत।
Look at this, the mouth is going
आँख
towards
बंद
the right
कीजिए।
one, right side.
पूरा बंद आँख बंद कीजिए,
Cannot
मुंह बंद
close her
कीजिए।
left eye.
आँख
It's a
बंद
clear
कीजिए।
case of left-sided Bell's
ठीक है।
palsy.
फुलाइए मुंह।
The mouth is deviating towards the right side.
ठीक
It
है।
is a clear case
आँख
of
बंद कीजिए
left-sided
फिर।
Bell's palsy. She cannot close her left eye properly. See the follow-up.
सिकोड़ा ऐसे। हाँ अखियाँ ऐसे अखियाँ बंद करो दोनों।
He can close her
ऐसे
both
करा
eyes.
देखा ऐसे करा ऐसे। हाँ दांत दिखावा।
The frowning is also present.
अब
On
बहुत ठीक
showing
हो
his
गया
teeth, the mouth opening
हैं?
is also symmetrical.
अब मुंह में लार ना गिरा था
ना खाए के बर्तन में कुछ गिर जाए
पहले से।
पहले ही से वैसा ही नहीं खाए के बजे या
It's telling that when she eat food, there is slight amount of expulsion of the saliva from the affected side, from the left side of the mouth. This is the third one. The third one. Yes.
हाँ
The mouth
माथा
opening,
सिकोड़िए। हाँ आंखें बंद कीजिए।
wrinkling is present. Now she can close her
एक बार फिर
both
दांत
eyes.
दिखाइए दांत ऐसे।
So much strength. The mouth opening is
ठीक।
also very symmetrical. She is all right. And see the age of the patient. She is more than, 75 years of age. So even in 75 years of age, we can see great improvement in Bell's palsy. And the last case, my dear friends, I'm going to show you the last case.
अभी आंख बंद करा। आंख बंद करा अपन।
You
टोपी
can
हटावा
see
तो
the
मथुआ
strength
दिखाई
in
दी
the
बाहर।
eye. The right
टोपी हटावा।
eye having less.
माथा सिकोड़ा।
The left
माथा
eye
सिकोड़ी
having.
आंख खोल लीजिए। माथा सिकोड़ी ऐसे ऐसे। हाँ दांत दिखाइए।
Look at this. The mouth is going to the left side.
हाँ
It is a clear
राइट
case
साइडेड
of
बेल्स पाल्सी
right-sided
था।
Bell's palsy.
उस दिन आंख नहीं खोल रही थी। वो दिन वहाँ आंख जो है बंद नहीं हो रहा था ना दाहिना आपका।
Unfortunately, I don't have the first video of this patient.
हाँ हम जाना थे वो दिन
Follow-up
वहाँ
video
ना
when
बंद
we can
होते।
see
ठीक है।
the deviation, the mouth on showing his teeth to the
ठीक।
left side. It is a clear case of right-sided Bell's palsy. Look at this.
माथा सिकोड़ा। माथा सिकोड़ी आंख खोल लीजिए।
I'm showing you
माथा सिकोड़ी ऐसे ऐसे।
again.
हाँ
See,
दांत दिखाइए।
look at this. The mouth is deviating to the left side. It is a clear case
राइट
of
साइडेड बेल्स पाल्सी था।
right-sided Bell's
उस
palsy.
दिन आंख नहीं खोल रही थी। वो दिन वहाँ आंख जो है बंद नहीं हो रहा था ना दाहिना आपका।
अब तू आप न जानो।
हाँ हम जाना थे वो दिन वहाँ तो ना बंद होते। ठीक है।
हम कहते थे
The
कुछ
follow-up.
आराम हो।
ठीक ठीक।
हाँ काहे के लंबा काट देता है नहीं तो
हाँ
The mouth
टोपी
opening
उठा के माथा सिकोड़िए।
absolutely fine.
माथा सिकोड़िए पूरा। हाँ ऐसे सिकोड़िए। हाँ हाँ
And
ऐसे
by seeing
कीजिए।
the cloth which he has
हाँ
weared,
दांत
you
दिखाइए।
can understand that the
दांत।
weather is cold.
पूरा खोली दांत ऐसे।
Even in the coldest
हाँ
weather, the
हाँ
patient is having relief because Bell's
जीभ
palsy
नहीं
is more
ठीक।
common in cold weather. He's absolutely fine. See the mouth, the symmetrical opening of the mouth. Look at this.
हाँ टोपी उठा के माथा सिकोड़िए।
Now I'm going to come
माथा सिकोड़िए पूरा।
to my slides.
हाँ ऐसे सिकोड़िए। हाँ हाँ ऐसे कीजिए। हाँ दांत दिखाइए। दांत पूरा खोली दांत ऐसे। हाँ हाँ जीभ ठीक।
Now I'm coming back to my slides. But how can I come? Yeah. These are the medicines which I've given to those patients, capsicum and curare. But I want to ask a question that why capsicum and why curare? What is the reason behind selection of these medicine? The answer is somewhere lies in the structure. If you see the structure, this is the structure of the middle ear. The facial nerve passes through the middle ear. It passes through first, it enters in the middle ear through inner ear. Then it passes, passes through the middle ear by every structures. You can see incus, malleus, and steps. All the three bones are here. And it leaves the middle ear by passing through the stylomastoid foramen. So the most of the structure in the ear is covered by facial nerve. What I want to tell you, I just want to tell you that when a patient come to you suffering from Bell's palsy, you have to ask one question, that what was happened just before the attack. As I've told you, that patient is highly anxious, patient is restless, patient is not going to tell you about the events which has happened 1 to 2 days before the attack, because the weaker dynamic affection is extinguished in the living organism. What I mean to say, because facial paralysis is bigger than the problem in the ear, because most of the patients suffering from Bell's palsy will tell you that, doctor, I was having a pain in my ear, I was having catarrhal affection of the ear, I was having pain in the mastoid bone, pain behind the ear. So what is the relation of ear with Bell's palsy? The relation is the course of the facial nerve, because what is Bell's palsy? Bell's palsy is paralysis of the facial nerve. Involvement of the facial nerve is there. Involvement of the seventh cranial nerve is there. So what is the relation, my dear friends? As facial nerve is passing through the middle ear, so whenever there will be problem in the middle ear in the form of otitis media, in the form of catarrhal affection of the ear, in the form of mastoiditis, in the form of other problem of the ear, that problem may involve the facial nerve, because facial nerve is adjacent to those structure, close to that structure. So whenever there is inflammation of the middle ear, that inflammation may involve the facial nerve. When the virulence of the organism is high, when the susceptibility of the patient is there, when patient is suffering from some immunocompromised diseases, when the immunity of the patient is low, so many conditions comes in a row. And when all these conditions in combination or separately, there may be involvement of the facial nerve, and as soon as facial nerve is involved, after the ear problem, there will be Bell's palsy. This is as simple as I'm telling you. So the anatomical structure of the facial nerve is which is responsible for the selection of those medicine, the capsicum and the curare. Because when you go through the literature of capsicum and curare in Maitreya Medica, it is clearly written there that in capsicum there is mastoiditis. In capsicum there is catarrhal affection of the ear. In capsicum there is sensitivity to the cold. All the symptoms aggravate from cold. It is clearly written there. So capsicum is also applicable in Bell's palsy, and that's why capsicum is a medicine of choice. Similar thing is written in curare. Curare is a wonderful medicine for left-sided Bell's palsy. In curare, it is written that there is involvement of the ear, there is catarrhal affection of the ear, there is mastoiditis, there is problem in the ear. And because of that, these two medicines are having great action in Bell's palsy. There is a reason behind the selection of these medicines, because all those patients which I have shown you, the video of all those patients which I have shown you, they all had ear problem just before the attack. Not one case, not two cases. I've shown you 5 cases. Why 5 cases? Because if your interpretation is correct, if you are thinking right, not in 1, not in 2, not in 3, every cases, if the interpretation is correct,
Yes.
you will have the same results, my dear friends.
Yes, sir.
These are some of the
Sir,
I'm just concluding, sir. 1 minute only. These are the some of the medicines which can also applicable in cases of Bell's palsy, causticum, belladonna, cadmium sulf, and Seneca is a left-sided medicine. Califos, Rutaji, and Brownia is a right-sided one. Causticum is applicable for both sides. These are also some of the medicines which are, having great action. My dear friends, what I'm trying to tell you, I'm just trying to tell you that just understand the cause of the disease, understand the cause behind the cause of the suffering, understand and do the correct interpretation of the symptom. If you are doing all these things in acute cases, I think you will have the great result. Thank you for the patience, for hearing. Thank you very much.
Yes, sir, exactly. That's what homeopathy is all about. And you have right. What a brilliant session it was. And I'm inviting Dr. Beatrice Gessner to say vote of thanks to the session, as there is no time remaining now. Definitely,
Yes, thank you.
we need some more
Yes, yes.
presentations.
So a great thank for being with us, and it was excellent cases with the Bell's palsy. You give us optimism also to treat in the same form, and very good advice to ask about the causes behind the symptoms. Congratulations, and also congratulations to IFPH having all these lectures during all these years. So many greetings.
Thank you. Thank you.
Thank you. Thank you, Dr. Vijendra, Dr. Beatrice, and those who attend the session in this evening. Since we have another session coming, we have to close the session in this beautiful presentation. Thank you all for this session. Thank you.
Thank you, sir. Thank you.
Hope
Thank you very much.
we can have some more presentation in the future. It's over to Dr. Manoj to moderate the Malayalam session.